Thank you all for joining us. And today we're going to focus on supervision with purpose, part four. So this is a four-part series. My colleague Amy Banco started most of the first sessions, and I'm following up. And today we're going to be focused on stress responsive supervision. Maybe the first time you're hearing it, or you may be familiar with that specific approach, but it's really focused on supporting staff well-being and service quality while you're providing effective supervision. So, what's extremely important is what really do we endeavor to really engage in and discuss today, and what are we setting the tone for, which is critical in the sense that I want to maximize your time and make sure that you leave with good takeaways and really instrumental knowledge, skills, and resource that you can certainly integrate into your daily practice in your role as supervisors slash leaders. So, all in all, today's session is really designed to be interactive and to really equip the supervisors slash managers with knowledge, skills, and resources that are needed to recognize and to respond to and to reduce the impact of stress on staff performance and program fidelity. The first thing I want to note is I was deliberate in not saying reduce your stress,
Turn it up a
if you
little.
note, right? Because we're not setting ourselves up for failure and we want to be very pragmatic and very concrete. This is about really helping you recognize the science and the impact of stress on staff's performance and program fidelity, right? How do you help people navigate and manage the inevitable omnipresent stress that we face and yet be able to perform optimally? So the hope is that you will learn and share and engage in all the elements that really help you understand how stress affects documentation quality, engagement, em- engagement with for those who work in supported employment, certainly employers, for those who work in supported housing, landlords, service planning, Medicaid, billable activity, the whole scope. The idea here is to really focus on the elements of trauma-informed communication and stress-responsive supervision, and really prioritizing those strategies that we found to work, that found to give people a sense of both utility and control over the things that they can manage. So, yes, sounds like we're really looking at a big ask here, but the hope is that we can leave here with something tangible. So, not promising the world, but promising some meaningful strategies that have proven to work. So, let's get into it. Officially, I want to welcome you and remind you that today's meeting is hosted by DBHR through the Washington State Healthcare Authority, and this is an interactive meeting. I want to make sure that you have the opportunity and lay out the red carpet for active engagement. And I want to ask if you can certainly do your best to participate during the session. A reminder that this is a recorded session and the recordings will be uploaded to the Washington State DBHR YouTube channel. So we'll also be providing the PDF of the slides as well. So look forward for that. A note about artificial intelligence. Please note that the use of automated note-taking bots or similar tools during Washington State FCS events or meetings requires prior approval. So please ensure that you seek that
Okay, so
approval.
that work.
I'm gonna try to, when I tried this out before, the sound on there worked, so I'm gonna see if I can't
Okay.
lose it.
Is that a question, a comment? I want to make sure that I am responsive. Um, so let me know if you have a specific question about that. So as I noted, the recording will be available to you on the YouTube channel, as well as the information regarding a PDF of today's presentation. So, as I alluded to earlier, our learning objectives are very specific, but yet broad, right? It may sound kind of incredulous in that sense. But we're really looking at how do we differentiate stress from burnout and describe how both may impact service quality and compliance. As we know, FCS, in all its service entities and modalities, really have a significant focus and emphasis on fidelity and quality of service. We want to make sure that those things are the forefront of what we're doing. We want to hopefully recognize the early signs of stress in our staff, in our team, and look at the dynamics and how we're using trauma-informed supervision approaches on whether or not we are and how do we integrate them into our daily supervision practices. We want to look at communication strategies that really enhance psychological safety and normalize conversation about stress. So really talk about it, really lay out that red carpet for our staff to feel comfortable and competent about coming to us to discuss stress, and we're taking proactive measures to ensure that we are vigilant as well as responsive to our staff in that regard. Want to identify leadership boundaries practices that protect staff well-being without compromising the expectations and the outcomes that we have for our program. What that really lends itself to is, are you modeling the appropriate practices that set the tone, that set the standards, as well as helping your staff recognize that they have permission and actually they have autonomy to set some boundaries for themselves because you're actually modeling that. We want to implement team-based interventions. How do we help our team really get the message across that they are stress responsive approaches that we can take to ensure that we're operating in a space that is both conducive to keeping, our foot on the ground, so to speak, while also being aware of the impact of stress and managing it the best we can. So if those objectives sounds lofty, we'll narrow them down to specific things that you can take away. But those are our learning objectives for today. Any questions there? Is that your expectation? If you're coming today expecting something different, I want to make sure that I'm streamlining it as to what we're expecting. Hopefully we'll get more than what we set out to achieve here today. So let's start off first by getting a sense of how things are impacting you. So I'm going to, if you can, take a quick minute and I'm going to ask you to respond to a poll with some questions that really give a sense as to how you see yourself in relation to stress. If you can, take a quick minute and let me know, how do you respond to the question, what causes you the most stress as a supervisor? All right, another 10 seconds, and then we'll take a look at the responses and see if we recognize ourselves in those responses, right? I think more often than not, when we think that our response to stress is unique to us or nuanced to us, oftentimes it's very common. Okay, so let's take a look. So, your response to what causes the most stress as a supervisor, primarily, wow, we've got a good spread here. A lot of folks says pressure from measurable outcomes, right? Those expectations that your agency have of you in terms of producing outcomes that are aligned with your program expectations and are responsive to the funding of the agency that really govern your organization, so to speak, as well as staff turnover. No surprise there. Staff turnover and measurable outcomes, take the cake, so to speak. Crisis heavy caseload also seem to be prominently noted there. Work-life boundaries. Now that is a surprise to me. So I'm going to ask you about that. I expected in my own, nuanced way, in my own presumptuous way that people were going to say work-life boundaries is probably the most prominent. But I'm assuming that that's a good sign. If people say we've got a good handle on work-life balance, it's just those pesky folks that ask us to do more with less. All right, that seems to be classically what it is. But that's fine. Oh, Lisa, I didn't think about that. ICE activity. I'm assuming that lends itself to some tension in the community. But once again, we're all about the things that we can control within our scope, within our purview. But thank you for that. So I think what's more than anything else critical to note is that even though these things may be prominent, a specific one may be prominent or may take the lead, at different times, different stressors have, either a more profound or a less profound impact, right? Tuesday, it may be we have two people resign and it may be staff turnover. Wednesday, it may be Medicaid coming to us and saying, why haven't you met the expectations? And you're pulling out your hair because Medicaid, you see Medicaid as this entity that just is unrealistic about the expectations. So it varies from day to day, but that's a good kind of global representation of some of the major stressors as a supervisor. Um, so yes, and even in behavioral health as supervisors, we have unique stressors that oftentimes may not be similar to other folks who work in different entities. And for some of you who may have partners or spouses or other folks that work in a different entity, isn't it a doozy when you are trying to share what you're stressed by and the person says, I don't understand that, all right? But why do you work in that? Why do you work in that kind of field anyway? Don't you expect that stress is just going to be lofty? And you're sitting there thinking, so if I don't do it, who's going to do it, right? And so, in as much as stress is prevalent, is profound, we understand that when we came into this field, if we're going to have a little extra oomph of the stress when we walk into this field, right? We're not bankers. So we understand that there's going to be some nuance and what we call it, realistic stress that comes with working around people who are facing sometimes the most significant challenges in their lives, as well as people who need the most from us oftentimes because they are oftentimes in a place where they require a tremendous amount of support. I think the first thing we need to acknowledge here is that the fact that we choose to come into this field and continue to do the great work that we're doing is in itself a tremendous gift, duty, responsibility, as well as, a badge of honor. So if there's anything you take away from today is in this moment, I want you to pause for a moment and recognize how significant what you do in relation to the people that you serve and the fact that you chose this field amongst all the others in itself is a reflection that you are a special person. So the one takeaway you're leaving here today with is you are a special person for choosing this kind of work and to do it with a smile and do it with the enthusiasm and optimism every day. First takeaway. All right, so let's get into the meat of things. So it's important once we talk about stress that we understand what really happens in the mind and body. Because oftentimes it's easy to just assume stress is this external stuff, right? That if we just get great at ignoring or just get great at understanding it's going to happen, then we should be able to cope. And we know those intentions don't necessarily work, right? Simply just putting yourself in the framework like if I just, learn to cope with it by just not looking at it in terms of how significant it is, then I'll get better. We know it takes more than that. It takes knowledge, skills, and resource to help cope. It's not by happenstance that we get better at managing stress, recognizing it early, understanding its impact, and managing it. And the first order of business is to understand what it does to our whole being, our body, mind. So let's start there first. So, stress is the body's natural reaction to challenges or perceived threats. That's important to note. It's a automated response by your body with a presumption that there is a stressor or a threat that is existing. When we face pressure, our body activates stress response. It's a stress response. There's the action of hormones like cortisol and adrenaline that surge, our heart rate increases, and muscle tense up. They're all designed to help us respond quickly to danger. So when we talk about stress in our response, it's a response to a perceived danger. In small doses, this response can be helpful, right? Our body naturally responds in a way that helps us modulate or manage it in small doses. The challenge is, if we keep in that state of alertness and motivated and focus, and the stress become constant or unmanaged, that same response that is naturally helpful to us can lead to fatigue, anxiety, irritability, and even physical symptoms such as headache, muscle tension, or sleep problems. So we know that stress that is prolonged, chronic, or not managed well can really lead to some detrimental impacts, significant ones. What we know as well is that stress starts in the brain. The amygdala triggers stress response. Cortisol is released and it heightens alertness. We get on, our hind legs and we're ready for the fight. Racing thoughts, narrow focus, we're alert, we're hyper vigilant, we're ready for that battle. And once it traverses the brain system, it gets into our body. We have increased heart rate and blood pressure goes up. Our muscle get tense, and oftentimes the significant unique focus leads to some headaches, and prolonged exposure to those elements which are naturally protective then becomes detrimental. Fatigue, energy drain, and other impacts that are negative to us. So the message oftentimes here is that stress is normative, stress is omnipresent. How our body is designed and built is to respond to stress very well in small occasional doses. When it gets chronic and prolonged is when things fall apart. Marissa says some of us are used to being on call and working in non-stop chaos. Work-life balance doesn't even phase out us anymore. That's true. Sometimes you just adapt to your circumstance, right? And yes, Rachel, stress is the body's response to a situation, oftentimes a sense of threat. And I think your point is very, very significant. Varying reactions to different types of stress, because we don't automatically respond exactly the same way. What happens often is that the more we're exposed to a specific kind of threat in small doses, we're able to kind of have an automated or a specific response to it, right? I think of it in the sense that a classic example is if we work in an environment where there's a constant risk of physical harm, whether that's coming from the person that we're serving or people who are proximal to that person, naturally what we start developing is an awareness of sounds, of signs, of body movements, of things that actually quickly get us ready for the threat of harm. We tend to have a better sense of, and that's oftentimes without even thinking, body posture and distance that allows us to feel safe, even if it's just, a general feeling. But we have to certainly develop and implement more specific strategies to ensure that we're not simply only tuning in to those things that we are familiar with. If that makes sense, because oftentimes we can go into a similar environment to be like, oh, the last time I was here and his voice was raised, I was able to de-escalate it and it got, to a place where I felt safe. Now, that person on that Monday may not be able to de-escalate. You may not be able to de-escalate them as you did last week. And hence, you don't want to misconstrue the same cues, assuming that because you were able to kind of get it down to a safe place, that's going to automatically happen. So the same cues can have different risk factors over time. So think of it for yourself. What physical signs do you notice in yourself when you're stressed? For me, I feel that sweaty palm and my shoulders feel like they're like bunched up. Those are my early warning signs of stress. Sure, if you can, what are some of your physical responses to stress, particularly intense stress or prolonged stress? Clenched jaw. Oh, yes. Feel like you're gonna, break your jawline. Clenching your teeth. Ah, Brianna and I have those clammy palms, right? That happens. That works. Uh, Start happening, you know what's happening, your neck and back pain. So there's lots of different signs, and over time, we can understand clearly what's our cachet of physical signs. We know what that means. Absolutely. So awareness is a significant element.
04.
So why do we talk about stress? I mean, why is it so important? After all, if we're saying that it's omnipresent, it's unavoidable, what's the point of talking about it? And that's important to note, right? We just don't want to talk for the sake of talking. We want to make sure that we're getting something out of it. So why we talk about stress? Because we know it impacts judgment and crisis decision making. And that is such a significant role that we play every given day of our work life. We have to make critical decisions and judgment that not only safeguard our lives, but sometimes safeguard the lives of the people we serve. It affects client safety and service quality. You make a decision driven by your response to stress. It may certainly impact and likely impact the safety of the people you're serving. Whether it's you reacting verbally in an inappropriate way or physically responding in an inappropriate way, there's lots of ways in which you can certainly impact the safety of a client and the quality of service you provide, right? Because remember, the therapeutic relationship has to be nurtured and has to be fine-tuned. So you have to understand how the circumstances related to stress are impacting that relationship. Stress, prolonged, chronic, unmanaged stress drives burnout, turnover, and morale. Sometimes we're fortunate, and this may sound peculiar, when a staff actually tells us they can't do it anymore and they need to find a different job, sometimes that's not a bad thing. People understand their limits and know, listen, before I do something untowards or something outside of my character, I may need to either step away or get some training, get some competence awareness or leave. So it's based on the nature of it. Stress is contagious in teams. Happens to one person, impacts the relationship with others, and before you know it, your team, your entire team, is significantly impacted by the stress, whether it's a collective stress or individual stress that are not managed well. So that's why we talk about stress and not simply talk about it as a dialogue, but we talk about it as something we have to face, address, manage, consistently assess and evaluate to ensure that the outcomes of doing so lend itself to greater awareness, greater competence of actually dealing with the early signs and also the chronic signs and managing it in a way that impacts the individual and the team effectively. Are there any other reasons why you think we should talk about stress as supervisors, managers in the field we work in? What are some other reasons why talking about stress, the dialogue leading to some proactive approaches or interventions, why is that critical? To stay healthy and certainly to prevent the known negative impacts of stress, from burnout to compassion fatigue to people lashing out, different things. Laurie, you're spot on. If you don't talk about it, you can't be about it. You can't address it. It starts with the conversation. It starts with everyone feeling that their contribution impacts the overall team, right? We want people to know that their awareness, their consciousness about it can really lend itself to collective decision making that can impact everyone else. Absolutely. Starts with that awareness and that ability to discuss it meaningfully. So, why stress awareness matters at work? First, by recognizing stress early and addressing it, we can prevent it from turning into burnout and anxiety or depression. Now, let me be very clear. Simply recognizing the early signs and addressing it does not guarantee that everyone is not going to be impacted by the potential of burnout and compassion fatigue. In many instances, it may allow for folks, particularly your team, if you're a collective team that is working well together, to moderate, mitigate, or minimize the impact of burnout. So it lends itself in that regard to both being able to really seek the warning signs early, address them,
How's it going?
and
Doing
also
good. Feeling busy,
all
jumping
right.
from one thing to the next. How was your
Let me
day today?
remind folks that if you're not addressing the team, you should be wary that you may need to mute. So it's understandable. It's also an opportunity for organization to create supportive environment. If there isn't an awareness at the organization level that stress is really impacting people's performance and quality of life and quality of care, there will not be a need to really look at it at a systemic and organizational level. It also allows us to have that open dialogue about stress, talk about it. A major part of addressing it is really recognizing it and talking about it and normalizing its existence and its impact. And we want to normalize discussions about mental health. We don't want folks to wait until they are so defeated or so overwhelmed that the discussion you're having is an exit interview. You want to have that in the midst of people working towards addressing it meaningfully so that they can manage in spite of it. And that's an important one. Someone mentioned I had to step away and do a unilateral move for one department to not because I lost my poker face. Yes, sometimes we have to remove ourselves, right? Particularly if we don't feel that we can manage the circumstance there and we don't want to do a disservice to that team. So sometimes it does require removing yourself, but having an awareness as to why and how removing yourself can benefit you. Because sometimes, I always say, you can't run from your shadow. And that's a colloquialism, but it concretely means if you just keep running without addressing it, it's going to catch up with you at some point. So, point of note. Now, as a supervisor, it's important to look at things from the perspective of holistic stress awareness. Because sometimes we can pigeonhole things to just look at stress in our job or stress in at home or one iota of the stress continuum. And that lends itself to sometimes, either misconstruing things or not really looking at things on a global level. As a supervisor, manager, or leader, stress comes at you in all directions. You have leadership stress, those are the expectations, the standards, the outcomes measures. You have team stress. How do you manage or how do you help the team self-manage and self-moderate? How do you then execute a good work-life stress balance that allows you to perform effectively in both areas? Because that's important. Simply, the concept of once I get to work, I can leave my home at the door, or once I leave work, I can leave and get home, I can leave and work at the door. It doesn't work that way, as we know. Even if we fool ourselves into believing we simply can just leave it at the door, it follows us. I often say to folks, it may not be in your front pocket, but it oftentimes is in your back pocket. It walks with you. So it's important to recognize that. The first thing we need to do is acknowledge that mental health supervisors manage complex stress, right? People who work in behavioral health manage complex stress, their teams, and everything else. And transforming leadership to embrace a holistic approach involves prioritizing overall well-being and growth of leaders, integrating stress management, mindfulness, and emotional intelligence training. So it takes more than simply saying, I recognize that I'm being stressed here or stressed there. You have to look at it in its global sense and how it's interconnected, interdependent, and exacerbates, different elements of it. One could be exacerbating the other, and before you know it, things could be totally out of control in all entities of your life. I love that. Laurie says, I'm 3 nights a week when I get home, I get a foot rub from my husband. It puts the day in the very back of my head. Absolutely. Sensory approaches. Bubble bath. Whatever works for you. The idea is to recognize that the stress is coming with you and you try to moderate it with some specific strategies that you've tested and it's worked. Absolutely. Kudos to the great husband. We have to listen as guys, we have to take our kudos once in a while. We don't get many, but we'll take it. So it's important to recognize that as supervisors, we're not only dealing with staff relation stress, right? There's stress in many other aspects of our lives. And hopefully we'll get some guidance as to how to manage those elements as best as we can. It's also important to differentiate between stress and burnout. There's a consistent pattern of people confusing those two or confabulating those two, right? Stress, when we talk about stress, we see the indication of people being overengaged. There's intense emotion, there's urgency, there's too many demands. So what we talk about when we are trying to differentiate that, we're talking about the feelings that lead to a certain thought pattern and then a certain behavior. So there is a connection between how we feel, how we think, and what we do, how we behave. When stress is abundant or stress is there. And I see a tremendous amount of different approaches people are using, from kettlebells to gyms. I love it. I'm going to have to take an inventory of the great things that the folks in Washington do because you guys seem to have it covered. But it's important to distinguish between the two. Burnout, on the other hand, is really when you see, instead of someone being engaged or over-engaged, you're doing too much, they get disengaged. Even if they're actively performing something, there isn't that psychological and emotional connection to it. There's a level of disengagement. Folks present as numb and flat in their emotions. There is either verbal or kind of overtures, whether physical or psychological, a sense of hopelessness. People don't either verbalizing, I don't know. A good example is, no matter what I do, nothing seems to change. When that level of hopelessness becomes prominent and evident, you're really looking at burnout. And people feel that no matter what they do has no meaning, it has no impact. No matter how many times I talk to the landlord, nothing seems to change. Might as well just not engage. Those are indicators of burnout. And there's lots of material that really helps you distinguish the distinction between burnout and stress. I suggest that you take a conscious look at that because the one thing that you have to be careful with as a supervisor is not coining or indicating someone is burnout when they are demonstrating signs of stress. As we know, we don't want to take on the diagnostic role for us, for our staff. If people are stressed and that stress seems chronic and profound, we certainly have the responsibility to address it with them and link them to the appropriate resources. But we don't want to take on the role of saying, what I'm seeing here is that you're burnt out. You want to be able to look at the behaviors and really help distinguish between burnout and stress for that person. And we'll talk some more about some probing questions that could lend itself to better understanding of what people are experiencing. Does that make sense? Is that helpful to see some of the indicators of the distinction between burnout and stress? And a reminder that we're not there to diagnose or to indicate where someone is in that continuum. Now, we obviously have a sense that FCS roles are stressed. But why are they high stressed? From looking at housing instability and eviction threats, which lend itself to sometimes this feeling that, things are way beyond our locus of control. If you work in supported employment, employer rejection of participants with barriers can lend itself to you being very stressed with both the system and that specific employer. Documentation tied to reimbursement, if you're not getting those notes in, if you're not getting those assessments done, if you're not getting those plans done, it may impact reimbursement. And if you don't get sufficient reimbursement, you can't maintain staff. And if you can't maintain staff, you can't maintain the service. All these things are interconnected. You may be trying to coordinate and navigate multiple systems that are bureaucratic and very challenging to navigate. Absolutely. We have I call it a national housing crisis. So we understand that comes with particularly affordable housing or supported housing is very challenging. So there are loads of reasons why FCS roles are high stressed. It's important to note them because when staff come to you and say, well, this is what is happening and I didn't understand why this should be this stressful. Sometimes it's okay to be like, listen, working in foundational community supports is a stressful job. We have to acknowledge that. But there's ways and interventions that can help you moderate or modulate those stresses. Now, when we think of stress, we talk about what is the response physiologically and psychologically. How do we really respond to stress? And we talk about the stress response, particularly in our field. The stress response system, or fight or flight, is the body's automatic reaction to perceived threats, including the brain, nervous system, and hormones. So, oftentimes when we feel or acknowledge that stressful element in our lives, there's an automatic response. whether it's fight, see staff getting into confrontational tones or over controlling, you want to manage everything in your environment. Oftentimes, that's a way of taking the threat head on, right? And that's considered the fight mode. Some folks may approach it in a way that that particular stressor may result in that person taking flight, avoiding it, delaying it, procrastinating about it, simply not to have to deal with it head on. Or freeze, indecision or shutdown. Someone be like, listen, there's too much notes. I don't even know where to start. The progress notes are overwhelming. I don't know where to start. I'll do it next Friday when I come back from leave, after my sick leave, a long list of rationalizations and excuses. Laurie says, I'm all of this. Most of the times, we can be all of that at different times. Or fun, over accommodating, overworking. This is one that I think it's important as supervisors we recognize early and address it early. If we see staff who are over accommodating, oh, don't worry, I know everybody's got a lot of notes. I'll do some notes for you. I'll do some notes for you. Let me go take your client. And before you know it, they are over accommodating and overworking. It oftentimes leads to that person crashing and burning. And what happens very often is that person crash and burn, but then they turn and blame everyone else in some instances. Well, I had to help that person, or that person needed me to do that. That's why I was doing A, B, and C and not D. So I always say, look for the pseudo heroes, the people who are taking on that hero mentality or the martyrdom mentality without understanding that it's a stress response that may not be appropriate for the particular stressor. Are you familiar with the stress response system? Or is this new to you? Great. So I see there's some familiarity. Yeah, oftentimes you hear the flight or flight response, but over time it's really blossom and evolve into greater sets because there's fight, flight, and freeze. There's lots of different iterations of it. And the Harvard Health has a lot of information regarding that. You can certainly check it out. But it's important to note. Okay. So let's do an activity. Now that we understand that our automated systems in our bodies and mind really lends itself to addressing stress in different ways, I want to see if we can connect it with specific behaviors. So let's do this activity. I want you to identify whether it's a fight, flight, freeze, or fawn example. Now, this is not intended to stress you purposefully, but this is intended for you to think. So, a staff gets argumentative after overdue notes. You note to staff, listen, you've got a lot of overdue notes here. What's going on? And the person get argumentative. Hold on, Rachel. You can't come at me like that. I've been doing my notes for the last year. This is the 1 month I'm not managing. Why are you in my face about it, right? Or seriously, you're asking me about progress notes when none of my clients can get housing, when I've tried all this stuff and I fail, and you focus on progress notes. Management is always bureaucratic, right? People come up with all kinds of argument. Now, what do you think about that? Is that a fight, flight, freeze, or fawn? Ah, so we'll go over them. Now, what do you think of another? Staff avoids the landlord or employer calls. So instead of dealing with the conflict with the landlord, we're like, I see that phone ringing, I leave it alone. Landlord leaves a message, I avoid it. Staff overfunction to manage client needs. So the staff, instead of doing a 1 hour session with that person, is spending 3 hours taking them to every grocery store, every appointment, every stuff, in spite of the fact that the consumer is capable of doing those things for themselves. They're doing for as opposed to doing with. So I think most of you kind of got it. I want to give you an opportunity to kind of process, but staff becomes argumentative over do notes is fight, right? They take on that stuff head on, they get defensive, and they start getting into that argumentative mode. That's what we call a fight response. Staff avoids the landlord, employer, and cause is flight. If I don't deal with it, it doesn't exist. Over functioning to manage clients' needs is fawn. That person becomes the hero, right? They want to do everything for everybody and not manage the circumstance very well. So these are some examples of truly understanding from behaviors what specific stress response that person is engaging in. So good. I think most of you got it. So as a supervisor, I want you to gauge this communication and response and see if this makes sense to you, see if this seems to be effective and appropriate. Supervisor's response. Why haven't you finished the notes? Have any of you been in that situation where you just feel the need to just lay it out like that? Why haven't you finished your documentation at the deadline? And Cameron says it makes me ready to fight, right? Yes, indeed. Is that a familiar overture, a familiar statement, a familiar response that you engage in or you've heard other supervisors engaging? By really believing that if I just call that person out and I put them on blast, they're going to change and they're going to do what is necessary. Is that familiar? Is that something that you've and there's no judgment. Simply wanting to get a sense as to whether or not that's something that you're familiar with. I love that, Cameron. She says if she has a great manager, they will ask how to support me getting the notes done. Marisa says we use the language you have until this date to get it done. And someone says, I've heard it. I know I've heard it. And a few times it's come out of my mouth and I have to check myself. Because like anything else, we can get overwhelmed with our expectations and impose it on someone else and project it. Absolutely. And I think someone alluded to what's the appropriate response, right? Which would be an example like, what challenges got in the way of documentation this month? Now you have to be very careful in terms of you're trying to explore the reason for where that person fell short or didn't meet their expectation without either excusing it or rationalizing it. Because you don't want to make the mistake of being, well, I noticed that you haven't finished your notes, but I assume that you're overwhelmed. That is not good management approach. That is laying out an excuse that is going to be used for infinitum. So it's important to inquire about the challenge. And yes, it may lend itself to you sharing tools or approaches or strategies that has worked for you or you think is appropriate for that circumstance, but it's appropriate to explore that person's perspective about their reason why they are not meeting their expectations. So you can then help them either gauge or rethink or clarify what the expectation is, or acknowledge that they may be unable to meet that expectation and then you have to process it. So it's important to start from an exploration perspective. Ask the question. Evoke some kind of response from that person that lends itself to you understanding what's challenging them. Does that make sense? because it's important for you not to assume, not to blame, not to project. Inquire, get a sense of it. The early warning signs are important. If we see them early, we can address them early, we can lay out the plan. And this is in a FCS specific context, right? Excessive after hours note writing. Now, those staff will be like, well, Paul, I'm going to stay a little late and complete my notes, because I don't do very well when everyone else is around, or this is the time that I get to focus, and before you know it, that person is spending every weekend, every Friday, they're staying until 8 o'clock at night doing their notes. It may seem like an effective way of doing things, but it lends itself to someone procrastinating or not addressing things in a timely manner. Avoidance of employer-landlord contacts. When you see people coming up with fantastic excuses as to why they're not addressing some of the other providers or linking or coordinating services, it's important to know. And that's understood. Happens to us. Meeting reactivity. In a meeting is when that person, lays out all their troubles in a way that is so projecting. It's like, hold on a minute. This meeting is about addressing this stuff. It's not about you talking about your own personal affairs for the next half an hour. So there's an appropriate time and place for that. You should be addressing that as supervision. Chronic sick days. Someone is calling out often, calling out Mondays, calling out Fridays, calling out middle of the week. Patterns. Minimal engagement planning. When people are just meeting clients by happenstance or when they're in the mood, as opposed to having a schedule. These are the early warning signs that people are not managing very well and they're lending themselves to potential overwhelm. Important to know. And it's not simply for the supervisors to know this. What's even helpful is to lay this out to your staff and be like, here, research has shown these are the early warning signs of someone not managing their work balance very well. I want you to be aware of it. So if you see this early, you either address it or come to me and we can address it. Absolutely, Brittany. You'll get the slides at the end of it. So it's important to know the early warning signs. Now, a quick activity. I want you to rewrite this supervisor script in your head and just share it with us, right? Here's the task. Rewrite it. You've missed too many notes this week. You need to be more organized. Supervisors speaking to their supervisees. In terms of being an inspirational, proactive supervisor, how would you rewrite? How would you change that kind of overture dialogue? How would you change your response? Or would you? So once again, supervisors addressing the staff. You've missed too many notes this week. You need to be more organized. Is there a more appropriate, salient, clinically prudent way of addressing that concern? Someone says, I've noticed that some notes from this week seem to be missing. How was your week? Is there any support you need in order to move forward, ensuring everything is completed on time? Great. I would suggest you take the last statement and make it the first statement. What kept you from taking any notes this week? Is there some way I can assist? Fernando, great. I always warn supervisors about this. If you start by saying, I noticed this is happening. Is there some way I can assist? You have to prepare yourself. What if the staff says, well, yes, you can take some of these notes and get them done? Then you put yourself in a tough situation. Because you're automatically, when you say if there's some way I can assist, people may misconstrue that to believe that you want to extend yourself to them. So, even the statement of the response has to be carefully crafted. I notice documentation is behind. Workload may feel heavy. What adjustments would help you catch up? Three elements are in that statement. An observation. It's not personal. This is what I notice. I can actually say I notice this by checking your notes. Workload may feel heavy. You are trying to connect and share with that person an understanding about what may be occurring without excusing it or allowing them to believe that's a good excuse for not doing it. Workload may feel heavy. You notice I didn't say workload is heavy. I moved from that to a feeling. It may feel heavy. And remember we talked earlier about the feeling may make you think a certain way, may make you act a certain way. So once we get to that feeling and that person says, yes, I feel like the workload is heavy, then you certainly can share. So what adjustments will help you catch up? Notice, I'm not saying as a supervisor, what can I do to help to take that load off of you? Because we all have loads to carry. I'm saying what adjustments, what changes, what interventions, what new approaches you may be able to take to catch up, to be accountable for what you are accountable for. Does that make sense? Do you see the deliberate nature of the communication and what it's meant to relay? And it's very different from simply saying, you're late for your notes. What can I do to help you? Or is there anything I can take off your plate? And you just jump to that assumption that the person can't manage. And therefore, you need to intervene. Your objective is to state your observation, to express a connection with that person in a sensitive, compassionate way. Given the nature of work we do, you may feel that the workload is heavy. Then you ask the person what adjustment they can make to meet their expectations with your support. Very distinct and clear response. Is that helpful? And it's a skill. That's one of the things I want to make very clear to folks. It's a skill. It doesn't just come by simply having good intentions. You have to practice it. You have to get an awareness as to what you're intended to relay. So that's an example that you may be able to use specifically. So what do we do as leaders in our role to be more aware of stress? First thing we do, and we talk about that over and over again, we want to normalize the conversation about stress. The more we talk about it, the more we're able to address it, the more we're able to indicate the early signs, the more we're able to share clearly what accountability lies on both sides of staff and supervisors. We want to model healthy boundaries. We have to practice what we want to see in our staff. We want to address workload realities. People are dealing with an intense caseload that has tremendous stuff. We need to really talk about how to balance that. But we also want to make sure that we're clear about you knew when you signed up for this job, there was an expectation that you'll be doing progress notes for each client you see. That's not going to change. How can we help you adjust to better manage that accountability? We want to promote psychological safety. This is not about you versus I. This is about my job to monitor and to support you and hold you accountable, as well as give you a pat on the back when you've actually done the things very well. We want to provide constructive support, not fixing. Our job as supervisors is not to fix. So this is a very clear and definitive guide. I always say with folks, if you're uncertain, particularly when you're having, print this out, put it next to your laptop or computer, and resort to it when you're having that conversation about expectation. So there's some communication tools that we should use as leader, right? We want to validate stress. That sounds heavy. The reason why we do that is that people can either agree or disagree. If they disagree, then we can ask them, tell me how it makes you feel, tell me what you're thinking. Allows us then to have a conversation that is accurate to that person's experience of the stress. We want to name patterns without blame. Over the last 6 weeks, I've observed A, B, C, D. Can you help me understand what that is about? Are you willing to share what specific challenges you're facing and what kind of supports that may help you better manage your responsibilities? We want to ask support-based questions. What's draining your capacity most right now? What would make this workload more manageable? You notice we're asking that person to think, to process, and to get into their own competence and confidence about managing it. Let them tell you, well, I am struggling with this specific task and I have some thoughts about what can help me better manage, and then you determine whether that's feasible. But it's not your job to try to basically scaffold everyone because you will become the person that's overworked and underappreciated quite often. In efforts to support people that we work with, that we are part of our team, we have to model and set clear and definitive boundaries, healthy boundaries that can be emulated and can serve as a model for our staff. First and foremost, protect billable documentation time. If we do it, we can then say, this is the model for doing so. So those passing conversations and stuff like, do you have some time? I want to chat with you about ABCD. As a supervisor, you may be able to say, Brianna, I appreciate your willingness to, share your concerns with me, but this is my dedicated time for doing reports. On Fridays between 1 and 3, I am completing reports that has to be sent to Medicaid. I have to respect that time and set some limits on that time. I'm certainly open between Monday, Tuesday, this time. You have to model that. Protect that billable time. Limit after hours communications. I know someone mentioned about being on call, maybe your responsibility, but it's important to limit it. I always say, unless it's a critical, significant incident, do not be calling your staff after hours discussing stuff that can be discussed the next day because you're setting a bad precedent. Teach prioritization and avoid overwork. As a lead, as the model, you have to show folks how to prioritize responsibility and accountability and avoid overwork. Which means, as a supervisor, you can't be holding people to the standard of you shouldn't be doing your notes 10 o'clock at night when you have all day, but you're staying into the office until 10 o'clock. The idea of doing what I say but not what I do doesn't work, as an example here. You have to set those boundaries and hold them. Take real lunch breaks. I know a lot of supervisors who believe that grabbing a sandwich and eating it with one hand and a computer with another hand and in your office and is a good way of showing people that working hard is a great way of meeting their highest expectations. It's an awful example. As much as it may be difficult, you have to model good boundaries. Listen, I go to lunch Monday to Wednesday from 12 to 12:30. Please understand that very carefully. You come knocking on my office door and you have a crisis always at 11:25. At 12:25, you're going to be infringing on my lunchtime. Unless somebody's dying or the building is burning, I am holding my lunchtime. And I think you should learn from that example. Do you see these boundaries being set by your supervisor, or do you uphold these boundaries yourself? And this is a safe space. We can be honest, no judgment here. But we talk about how do we model setting and affirming good boundaries. These are some examples. What are some other examples of boundaries setting that you may have found to be effective for you? I know, Holly, you're not alone. It takes some work. So sometimes it's tough, taking proper breaks, even though I make sure everyone else gets one. That's sometimes it's natural stuff to take care of everybody else but ourselves. But as a supervisor, as a leader, it's important for us to set an example, even if it's hard. Stay home when I'm sick. Oh, please do. And I'll share this. My biggest gripe with people I supervise is I don't need you at work sick. Because it speaks to two things. If you're coming to work when you're sick, I question your self-care. And then if you're coming to work when you're sick, I question how you care about other people's health. But we live in a society and we work in a society where there's that expectation, unrealistic and improper as it is. We sometimes have to wean ourselves off of it. And actually taking time off. Yes. Schedule your vacation. Share appropriately some of the great things that come from taking your vacation. Right? I always say it is okay for your staff to see your background changing based on where you last holiday or where you went for vacation. Now, I don't want you sharing every single thing that happened in your vacation. That's not appropriate, but certainly, set a good example that vacation is critical to your well-being and your recharging. Fantastic, Cameron. Block out lunchtime so we make sure we take it. We make sure you take vacation days. Absolutely. There is no greater reward. How do you set those boundaries? Because it's easy to say, I know these boundaries, I should set it. What do we do action-wise, proactively to do so? First and foremost, we need to define the focus. Clearly state what you will do versus what you wouldn't do, showing what truly matters. Because what you will do will be indicative of what's important. Communicate clearly. Verbally share your needs and preferences so colleagues understand how to work with you effectively. This is what I need for my team. This is how I prefer it to be delivered. So that people don't have any uncertainty or ambiguity about what your expectations are and why those expectations are in place. Establish limits on work hours and commitments to avoid burnout. Keep yourself charged, keep yourself properly cared for, set as an example and a model for your staff. Encourage team boundaries. Explicitly tell your team that they can set their own limits and thank them for sharing their needs. That's important for your team to not only know what you have as a standard and a model, but when they're emulating and repeating those models, give them their kudos. Model rest and recovery. Take breaks and vacations, showing that downtime is essential for high performance. It's not a weakness. And be consistent. Follow through on the boundaries. Don't just talk about it, be about it. There's no greater folly than saying that this is what your boundaries are and never upholding them. The personal stress boundaries. As a leader, what do you do for yourself? What do you do that helps your team understand how you lead and why you lead the way you do and how it gets the outcomes that it's intended? Stop rewarding overwork. That person that comes to you every supervision and says, I've been here, I spent 4 more hours than I needed to, and they're waiting for you to give them kudos. You don't give congratulatory, stuff about people who are overworking themselves. Say, hey, I noticed that you consistently tell me that you're here 3 and 4 hours beyond your scheduled time. Can you help me understand why you think there's a need to do that? And what may you need to do to better align yourself with your scheduled time? Take breaks physically. Tell your team, listen, I'm going on my break. I'll be back at this hour. Please manage things as best, as you should within that time. The greatest definition of a leader, and I'll share this with you, and I learned that from the first supervisor I had, is the awareness that you can go to bed or be out of the work with an assurance that your staff will do exactly what they need to do as though you're there. Does that cue in? If you keep that in your head, it's a good reminder. Leadership is not necessarily about cracking that whip when you're there, right? Or only when you're present, people should respond in the appropriate way. It's about people understanding the need to do exactly what they need to do, like if you were there. Set communication limits. I know in some instances you're on call, you have to take calls, but don't unnecessarily engage with people outside of the scheduled hours for reasons that really don't lend itself to any critical things. And it's okay sometimes to establish to your team, I need to pause and regroup. Because if you say that, you're permitting folks to understand that that's okay for them to do. And you are going to honor it and respect it when they do. Good modeling. Team stress reduction. So once you deal with how you can manage it, how do you then lend your team a good set of tools or a good toolkit to manage? Timed documentation blocks. Have people establish time for documentation that is specific, that is scheduled, and is consistent. Because unless you have a consistent schedule, you don't know what you can manage from what you can't. Crisis coverage rotation. And some teams, some agencies have specific rotations, but it should be alternating. People should not have to deal with crisis all the time unless it absolutely is a requirement of their job. They should be able to rotate that and share that among the team. Peer employer outreach or employee outreach. It should be employee, my mistake. People can go out in pairs if things are a little heightened or tense, or you think you need that kind of support. Engagement planning during meetings. Sometimes it's important to plan with your team how they're going to meet their expectations in terms of schedule and stuff during meetings so that you can come back and assess and evaluate whether or not they met their expectations in terms of the engagement. And there's other approaches, whether it's documentation, whether it's filing, really schedule those things as you should. Now we look at team strategies that work. Short, structured check-ins during meetings. We will establish that consistently our meeting. How are you meeting this expectation? How are things going with your team? What's going on with this client? We know that's a high demand situation. Really checking in so that your meetings are not purely administrative. They have some reflective supervision, some clinical engagement. And really giving people an opportunity to talk about things that they're struggling with and also some things they're succeeding with very well in terms of managing stress. Documentation, time protected, rotating crisis coverage, and realistic caseload prioritization, right? Look at folks and be like, can we look at the caseload again and see if it's equally balanced, see if people are able to meet it in a manner which is designed. So there's some effective strategies that we know work for teams. There's a 5-minute stress reset tools for staff and leaders. It can be from box breathing to other grounding strategies. So there's lots of different approaches to really resetting, that recharge, that pausing, and really connecting. One that I know we've talked about and we've shared with folks and has been very helpful to folks is the time box documentation, the 25-5 rule. What it does is the expectation is that you set a timer, right? You use a timer or an app to work on your documentation for exactly 25 minutes without any distraction. So you set that 25 minutes. After that 25 minutes of, little distraction and focusing on your notes, you take a short break. When the timer goes off, take a 5-minute break. You stretch, you get some water, you step away from the desk, whatever you do in that 5 minutes to kind of clear your brain and recharge. Then you repeat after the break. You start another 25-minute work session, and after 4 cycles, you take a longer break, 15 to 30 minutes. What this structure does is that it provides clarity and forces you to work within a constraint, encouraging progress and completion over perfection. So it really helps you to have a consistent pattern of doing it, taking breaks, organized, specific, and clear, and then coming back to it. And you find sometimes you kind of recharge and activate your brain. You can process better. You can have more focus. So really being able to set up some guided approaches to doing things that are known to be stressful, like documentation in some instances. There's many ways of doing it. Take a walk, name a stress or one action. You can really talk about naming that emotion, processing it, being mindful about it, and then moving on to the task at hand. So there's some examples there. Now, as a leader, you have to have an action plan. What I'm going to ask you to do from what we've discussed today, think of what can you take and add and integrate into your leadership or supervisory approach in the next 30 days? Think of it. Would you think about implementing a real protected documentation time? Are you intending on really limiting your after-hour messaging and engagement? Would weekly check-in for stressors in your team and yourself work, or would you prioritize planning with your staff? What is something that you can do, an action plan that you can implement immediately or within the next 30 days that can be impactful? It's important to take small steps, but take some tangible approach, something meaningful that you're going to integrate in the next 30 days, put it into practice, assess it along the way. Whether it's protecting documentation time, whether it's taking your breaks, whether it's scheduling your vacation, great time to do it in January. Even if you have to change and modify it, it's better to start with a plan. And Sarah says she's committed to limiting after hours checking messages. When I'm off, I'll be off. Absolutely. Great, Sarah. Look forward to hearing some from you how that goes. But you have to have a plan, an action plan as to what you're going to do in the next few days or next 30 days so that you're taking some meaningful action and measuring the outcomes. Which one appeals the most to you of these options? What do you think you're going to take some action, some concerted action towards? What are you going to add to your menu of activities as a supervisor to help you be more aware and responsive to the stress of a supervisor? While you're thinking about that, I want to look at what key takeaways we can have from today's engagement. First, it's important to remember and to reinforce that stress is predictable in the work that you do. It's unavoidable, but it can be managed if you recognize and modulate it as early as possible. Supervisors influence stress more than policies. Important to note. How we operate with our teams, how we model, how we set good examples can actually influence how stress is addressed and impact our teams more than anything else. Boundaries are leadership behaviors. They're not intended to be some limits or albatross for our team. They're intended to actually demonstrate good leadership behaviors, setting firm boundaries that we uphold. and allowing our staff to model that behavior. Remember, awareness improves documentation, engagement, and fidelity. If you are aware, you're conscious of what you need to do, you have some sense as to what are some options and what are some tested interventions and approach that has worked, you have an informed decision that you can make. It starts with awareness. So, want to make sure that we have a good sense of the takeaways from today. What I would ask is that if you can take a moment to provide us with some feedback in terms of how do you resonate with the training today? What would you like for us to focus on? What are some other things that we can do to make the training more responsive, more appropriate for you? We always seek your feedback and your guidance. And it's really been helpful in terms of shaping training to best meet your needs in the field. So if you have a moment, just provide us with some feedback. In wrapping up, I want to thank you. We thank you and appreciate your time and attention and participation. Remember, today's webinar was hosted by DBHR through the Washington Healthcare Authority. We'd like to remind you that the slides and a link to the recording of this session and a wealth of other resources will be available to you. Don't forget to check out all things FCS at the website. As usual, you've been a great audience. I want to thank you very much. I hope that you have a meaningful takeaway from today. And remember, what you do is critical. What you do is also meaningful. And how you do that in terms of both taking care of yourself and your team is just as critical as the outcome is intended to meet. So, thank you very much. Hope that you got a lot from today and you will continue to do the best job that you typically do, right? Fantastic. Thank you, Nikki. Have a great one. Look forward to seeing you guys next time. Take care of yourself and each other. Yes, the slides, the PDF of the slides will be emailed to you following, and then I think in a short while, the recording of the session will also be available on your YouTube channel